Good morning. This is Dr. Tariq. Today I am going to discuss some more questions about phlebotomy certification examination. If you remember these 150 questions, I am sure you will be passing the certification exam very easily. Now I go to the questions. Question number 1: which of the following is not an OSHA required personal protection equipment? Options are steel toe shoes, goggles, chin length face shield, full length lab coat. The answer is A. Steel toe shoes are not required. Question 2: certification is evidence that the phlebotomist is working in field. The phlebotomist has demonstrated proficiency in the area of blood drawing. Number C. The phlebotomist is licensed in the field. D. The phlebotomist is accredited in the field. The answer is B. The phlebotomist has demonstrated proficiency in the area of blood drawing. Next, the Clinical Laboratory Improvement Amendment of 1988 follows guidelines and standard set by the four options: CLIA 88, JACAO, CLSI, and CDC. The answer is B, CLSI. Next question: sample collected from a patient in a nursing home are sent to the POL, reference laboratory, CDC, and urgent care center. The answer is reference laboratory. Next, personal protection equipment. Personal protection equipment must be provided by the dash option Center for Disease Control and Prevention, OSHA regulation equipment. OSHA. C is employee and D is employer. This should be supplied by the employer and this should be supplied free. What is the phlebotomy? Option: a trained professional in the blood drawing, the legal standard for a person who performs blood drawing. C, the process of drawing blood. D, all of the above are correct. The answer is C. Phlebotomy is the process of drawing blood. Next, what is phlebotomist? A trained professional in blood drawing, the legal standard for a person who performs blood drawing, the process of drawing blood. All of the above are correct. The answer is A, a trained professional in the field of blood drawing. Next, the quality assurance for laboratory personnel includes all of the following except A, specimen collection procedure, B, specimen transport process, C, specimen processing policies, D, the laboratory's supervisor's home telephone number. The answer is D, this is not required. Next, which of the following is not part of a phlebotomist's point of care job related duties? Taking blood pressure, instructing patient on urine specimen collection, performing a tracheostomy, performing basic laboratory test. The answer is C, performing a tracheostomy. Point of care means it should be, your point of care is your patient or the bed of the patient. So anything that can be done alongside the bed, that is the part of this program. So tracheostomy is done in the operation theatre. Anything that is done in the operation theatre or outside the this point of care patient or patient bed, that is not a part of this program. The answer is tracheostomy, performing tracheostomy. Next, which of the following personal protection equipment must a phlebotomist use when performing a skin puncture or venipuncture? Options are goggles, gloves, mask, caps and booties. The answer is B, gloves. Under HIPAA, protected health information is defined as information that the patient refuses to disclose to the doctor, any test result, any part of a patient health information that is linked to the information that identifies the patient. Answer is C. Any part of the patient health information that is linked to the information that identifies the patient. Next, employers must provide vaccination against dash free of charge. Hepatitis A virus, hepatitis B virus, hepatitis C virus, hepatitis D virus. The answer is B. Hepatitis B virus. Hepatitis B virus. Which of the following would be a reason for rejection of a specimen by the lab? Patient name, date of birth, the date and time are written on the lab and requisition slip. Specimen containing an additive has been inverted. C. An ESR has been collected in a red top tube. D. All of the above are correct for rejections. The answer is C. An ESR has been collected in a red top tube. Next question. The quality of the test result depends on the type of specimen, the source of the specimen, the time lapse between the collection of the specimen and analyzing the specimen. D. Whether the sample is going to be analyzed for glucose or phosphate. The answer is C. The time lapse between collection of the specimen and analyzing the specimen. Next question. Most tubes containing additives should be inverted once, 3 times, 5 to 8 times. Tube containing additives should not be inverted. The answer is C. 5 to 8 times. Next question. Specimen may be rejected by the lab if the tube was not initiated, the blood is hemolyzed, the tube was not transported properly. All of the above are correct. The answer is all of the above are correct. So that is all about the question. I am sure these questions will help you passing the state certification examination. Thank you very much.